So we've been invited to talk about our approach to stammering with young children, and we've recently published a manual called
Practical Intervention for Early Childhood Stammering, the Palin Parent-Child Interaction Approach.
So that's what we're going to talk about now.
Okay.
Yes. So I think that it might be worthwhile starting with how we make decisions about which children need therapy.
Right. Well, we know that lots of children start to stammer, particularly in their very preschool years, and that a lot of those children who start then grow out of it. But there's been some really helpful research that gives us an indication of which children are less likely to grow out of it. The clearest indicators are if the child is a boy, he's less likely to grow out of it. If he has a family history of stammering, so he's got a family member who stammers, particularly if it's an adult, so someone who has continued to stammer, he's more likely to continue to stammer. If the stammer is not getting better, so it's either stayed the same since it began or it's getting worse, that's an indicator. And if it's been going on for longer than a year, that's also a bit of an indicator that they might not grow out of it.
Right. And what about the child where a parent was very concerned, or the child himself was very bothered about it?
Yeah. I'm not sure that there's any research that tells us that that child is more likely to continue, but it makes sense to us that it's important for us to help alleviate that concern, so we would want to see that child too.
And how young might the child be who goes to therapy?
We've seen children as young as 2. Basically, if a child is stammering, a parent is anxious, we'll see them.
Okay, so Palin Parent-Child Interaction, or PCI, would be suitable from 2 to what sort of age?
Well, the research that we've done has been on the preschool population, so children under 5, and it's been shown to be effective with those. But we use the principles of PCI actually throughout primary school years as a basis for where we start with our therapy, just making sure that the interaction around a child is helpful for fluency. So we would continue it beyond that, but put in other bits too.
So it's a fairly indirect form of therapy? You're talking about parents and interaction?
We're certainly not working directly on the child's mouth in the first instance. So what we're doing to start with is helping parents to see what they can do to support the child's fluency before we go in there and do anything directly with the child.
By advising, or how would it work?
Right. Well, the way that we do it is by helping parents to identify things that support the child's fluency. We believe that parents actually instinctively respond to a child stammering very appropriately. They know what the child needs to do. So parents will tell us that they'd like to say to the child, take a moment, think about what you're going to say, or they want to say, slow down, things like that. So parents realise what the child needs to do, but they're not always terribly sure how they can help the child to do that. So with parent-child interaction therapy, what we do is we help the parents to look at the way that they're interacting with the child, and we do that by using video. So we video the parent playing and talking with the child. They look at that, and from that they can see the times that they are helping the child with his fluency, what the things that they're doing that are helpful. And the therapy is about just doing more of that. It's not about doing it differently or changing the way they're talking. It's about doing more of what helps.
So does that mean that the parents are gaining confidence in knowing what to do, or?
I think so, especially since the premise is that you're already doing it, you already know it. We believe these parents are experts in their child, and therefore, you know, our therapy is not about telling them that they're doing anything wrong or anything like that. And certainly parents do report and improve confidence. And the other thing is that we have done research into the therapy, and we've found not only does it improve the child's fluency, but parents' confidence improves as well. We measure that as a part of our outcome measurement.
Could you give a sort of practical example of how you might help a parent to look at a video and decide what it is that's most helpful for their child?
Well, what we do before we look at the video, we just have a conversation with the parent about what it is that they think helps the child. So for example, a parent might say, well, I know it helps when he's calm and when he's talking slowly. So we then have a conversation about what it is maybe that they are doing at the moment that might help the child to feel calm or to talk slowly. And then we look at the video and we look for examples from that video of them talking and playing with the child. And you can always see them. So you'll see moments during that play when the parent's doing something that's very helpful. And the therapy then is about doing more of that, more of the time. But we set that up in a quite a structured way in that we ask them to do what we call a special time at home a few times a week, which is an individual time with the child when they just focus on doing more of that strategy to help the child's fluency.
Sounds simple.
5 minutes sounds like nothing, but actually parents sometimes find that a real challenge to find 5 minutes. We do recommend that they stick to only 5 minutes because it becomes impossible if you ask. You cannot ask people to go away and do something 24/7.
Right.
So we start with 5 minutes, and we find actually that parents do begin to generalise things without even thinking about making a conscious effort to do it.
Right. And one of the other things we discussed earlier was that it's not just about parent-child interaction. There are other features of the approach which are really helpful to the whole family.
That's right. So we start with the interaction strategies, working on those particular things that the parents can do. But we've also, from our assessment, identified anything else that maybe the family can be doing or the parents can be doing more generally to help the child's fluency. So it may be something like confidence building. All the children who come through the Michael Palin Centre, we focus on helping to develop their confidence, and we have a particular program that we use with these younger children, with the parents of these younger children, to help them to develop confidence.
And that's explained in the manual.
That's explained in the manual
too. And there was sometimes I think we've brought brothers and sisters in. Is that right?
Well, often we find that the parent might be helping the child to do something like take his time, and the child is doing that beautifully in a special time in that one-to-one, but put him in his normal family environment over the dinner table and it all goes to pieces because everybody's competing to talk. So we'll bring the family in and we'll do some fun activities with them which will help the whole family understand how they can support the child's fluency by taking turns and being aware of not interrupting and things like that. And that again, it's in the manual, and it's a really small but important way, I think, of ensuring that child's fluency.
So how quickly would a parent expect to see some changes in their child's fluency?
Well, the way we structure PCI is that we invite the parents in once a week for 6 weeks to the clinic, and they carry on the programme for that 6 weeks with clinic attendance, and then we have a 6-week period following that when they carry on the therapy but they don't come to the clinic. We call that the consolidation period. And our research has indicated that a child's fluency should be beginning to improve within the consolidation period. So we're talking about within 12 weeks. At the end of that, we do a review, and if everything is going well with the child's fluency, we would then just continue to monitor them for a year. However, if the child's fluency isn't improving, we then implement the third strand of parent-child interaction therapy, which is the direct strategies, where we're working on the child's speech directly with the child.
And that would be for which sort of children who would need the extra dimension?
Well, I think some of the children who have a higher level of risk seem to be the ones that might need the direct strategies. So the more indicators that this child is likely to continue to stammer, the more therapy they might need.
Okay, and so this manual is produced, so anybody can get hold of the manual, or any therapist could just read it and use it? Or?
The manual is produced and it's published by a company called Speechmark, and that certainly can be bought over the internet. The manual is there to equip a therapist to do pain and parent-child interaction therapy. However, we also run courses, and I would say the ideal would be for a therapist to have the manual and go on a course where they can see video demonstrations and practically try out some of these strategies. However, if that's not possible, the manual does stand alone as a way of training somebody. But we are always very willing to go anywhere in the world to provide training should it be requested.
Right, thank you very much.
That's a pleasure.